Hello, I'm Dr. Dennis McKenna. Today is Tuesday, September 29th, giving you the update from Albany Med. Ladies and gentlemen, he's back.
Thank you, Dennis.
It's good to have you. Yes.
Glad to be back.
We had a lot of great co-guests while you were gone.
Yes, I saw that.
They were wonderful.
They were terrific.
But
I wasn't sure I was going to have a job when I came back.
But everyone said, when is Dr. Venditti coming back? And you had something special happen while you were gone.
Absolutely. Our third grandchild was born, and so we were out in the Boston area helping our daughter and son-in-law with their kids. Yeah. So it was terrific family time.
For sure.
We had a good time.
Well, we're certainly glad you're back, for sure.
Happy to be back.
And we start with COVID as we've had done in the past. First graph, Capital Region. Currently, there are 15 people in the hospitals of the 8 counties currently being treated for COVID. And the next graph is here at the medical center. These are people in the hospital this morning at the medical center being treated for COVID. We have 7, Fred, 3 on the floor, 4 in the ICU, none on the ventilator.
None ventilated.
Right. And those numbers really have continued to be the same for the last couple weeks while you're gone. Yeah. 1 in, 1 out, 2 in, 1 out.
Even with a little bit of increase in the numbers in the community, our hospitalization rate hasn't really changed.
Right. Now, Fred, you obviously were continuing to keep up on things related to COVID while you were gone. We are all watching what's happening in different parts of the country, and we see some areas where the percentage of positivity is going up, and some cases where it's down under 1%. You wanted to specifically focus us on what happened at the Brigham Hospital over in Massachusetts.
Right. The Brigham and Women's Hospital in Boston is one of the Harvard major teaching facilities, as you know. And they actually had an outbreak within their facility. Yeah. Now, it's interesting, Dennis, they test every patient upon admission, and all their staff wear masks and supposed to wear face protection. Right. And they even have their patients wear masks when they can.
Right.
And what happened, they had a patient who tested negative twice, didn't wear a mask, walked around the floor, talked to the nurses, turned out to be positive, so was incubating, infected a nurse, infected other people. It was actually 3 generations of infections before they caught it. Okay. They wound up tracing 600 people who had been exposed. Okay. And as of last week, they had about 25 people positive, but we're continuing to get tests back. So, I think it illustrates a couple of things. It's important to wear masks because that was part of the problem. Face shields for staff taking care of patients, again, is very important. Being vigilant about those things, and not letting your guard down. Right. So the thought from the chief epidemiologist at the Brigham was that people were sort of battle fatigued and weren't following through with all the things that we've talked about.
You brought that up on your first day back here about not losing focus, and I appreciate you bringing it up again. I mean, we have been fortunate. We have not had any employees, I think, test positive now for over 2 months.
That's correct.
But we continue to test people who come back from quarantine states. We test symptomatic people. We're watching very carefully as well.
It's important for our staff to continue to do the good things that they've been doing that have resulted in no positives. Right. So wear your face mask, wear your shield, wash your hands.
Wash your hands and don't work sick.
Don't work sick.
Let's focus on emergent care. As you know, we have about a dozen sites out there, and there's a couple things that they're doing to specifically service the people who are in the area who might need to have some testing. So first of all, Fred, I think we're doing symptomatic testing at all of our sites now.
All the sites, that's right, Dennis.
And the turnaround on those is usually a couple days to get those results back?
72 hours, I think, or a little bit less.
Now, anybody who's a parent knows that there's a list of symptoms. Now, that if your son or daughter has those symptoms, they're going to be sent home from school.
That's right.
And they're not going to be allowed to return to school until they've had a negative COVID test and they've been cleared by their pediatrician.
That's right.
And often the pediatricians won't see them without the negative COVID test. And that list includes things like fever and cough. It can also include things like headache, abdominal pain, nausea, some vague symptoms. So our emergent cares and our faculty physician group are doing, I think, something very good to service that population. And before Fred or I describe it, call out to Dr. Arup Day, Emily Wright, really, who spearheaded this to make this happen. So what is it that we're offering?
So Dennis, we're offering testing within our urgent cares for those kids who need to be tested. It starts or can start with a telehealth visit, and then show up for that testing at those sites. So we don't want those children to come to our emergency departments.
That's important.
You know, that's a very, very important aspect of this. But the 11 sites that we have around the Capital Region all are providing this service for children and their parents.
So if your child is very, very ill and they've been directed to go to the emergency department by their pediatrician or EMS, that's different. But children who are looking for return to school clearance, stay out of the emergency department. Our emergent care is really the way to go.
Go to the urgent care.
And Fred, I think our emergent cares are also going to be testing for other types of viruses which can sometimes look similar to COVID as well.
There are really three, Dennis, right?
Right.
COVID, the flu, and RSV, respiratory syncytial virus, which is common in children at this time of year.
And will they be checking for all three at the same time when they come in?
Yes.
Yeah, good.
Yep.
All right,
Yep.
very good. Let's move on now to a couple non-COVID topics. This month is the Neonatal Intensive Care Unit month, and we want to highlight and thank that incredible workforce.
Shout out to them.
For sure. A couple things. First of all, services 25 counties. We've talked about that in the past with our perinatal program. Children sometimes as light as 2 pounds going into the NICU.
Yeah, it's amazing.
And 800 or so babies a year treated there. So we appreciate all the hard work that they're doing, and we want to thank them very much.
Really, Dennis, the most vulnerable population we care for.
Yeah, that's for sure. That's for sure. Fred, today is National Coffee Day.
I've had 2 cups.
I've had like 5. So it's ironic because we actually chose today, and I'm going to say honestly, we did not know this at the time, to announce that we are now going to be opening up the Dunkin' Donuts to serve around the clock back on the Medical Center campus, which for a couple months it had to be shut down in the evening time. The number of visitors were down, number of patients were down. It just didn't make sense to keep it running 24/7. But our staff said, our hospital's busier again, we're working overnight, what can you do? And so we're going to run it through the night, which is great.
It's really important for the staff here
Yeah.
at night to have access to that food.
And I think that Dunkin' also, with a purchase, you get a free cup of coffee, medium.
Medium, either hot
or
or
cold.
iced coffee today.
Very good. So
Go
anyway,
to Dunkin'.
So John DePaula, I think, helped make that happen.
Yes.
Fran Albert and Bob Basili, a couple others. So thank you very much. Fred, give us an update on the status of a couple very important chair searches. So we have people who serve in important roles here, and they've announced that they're leaving or they've left, and we've got to replace them.
So Dr. Stephen Stain, who's been the chair of surgery for a number of years, has announced he's leaving. He's going to Leahy Clinic in Boston area. He's done a terrific job.
He sure has.
So we've kicked off, or Dr. Verdile has kicked off that search last week. Sandra Shen, who is our chair of pathology, will be running that search.
Great.
So that'll be starting in the next couple of weeks with candidates. And then the CNO search.
Right, Chief Nursing Officer.
Chief Nursing Officer is something we've been working on for a while.
Right.
So we actually have 5 candidates who will start next week with Zoom interviews or WebEx interviews.
Okay.
Some really high quality people from literally around the country.
Wonderful.
So it's a relatively large search committee. It's about 15 people.
Here on this campus.
Here on this campus, who will do those WebEx interviews. Well represented. There are, I think, 6 nurses on the committee, a few physicians, some administrative folks from different areas, broad representation of the organization. So hopefully by the end of this month, we'll get through all 5 candidates.
All right.
This coming month.
Very good. Those are 2 important jobs, very important jobs. So we're going to keep you updated on those as we go along.
Absolutely.
Finally today, I'm wearing my fleece for human resources because tomorrow is the kickoff for Workday, which for people outside the medical center, that may not seem like an important news story, but inside it's a very big news story.
It absolutely is.
And it's an important web-based program to help us with HR and payroll. Probably too many people to thank, but I think primarily human resources, IT, and finance leading the way. Maybe some specific names you want to throw out?
So John DePaula,
Yep.
Darlene Sousa, Bill Duax
For sure.
have been very, very important in getting this up and ready to go. So it's going to be great tomorrow.
It's going to be great. And we thank everybody to make that happen. And we think it's going to actually be much better for our employees and our managers with this new system.
But we're going to go from paper
Right?
to the electronic world.
Incredible.
It's going to be good.
All right, I think that'll do it for this week. It's great to have you back. We'll be back again
Thank
on
you.
Thursday.
I would just do hello to Patty, Ellie, and Ava.
Nice. The fam.
The
All right,
fam.
good stuff. All right, we'll be back again on Thursday. We'll see you then. We ask that you once again, please take care of yourself, take care of each other, and we'll see you in 2 days.